privacy. Hello, my name is Christina. I'm a nursing student at Harper College. How are you today?
Good, thank you.
All right, so I'm here to do an assessment on you. Is that okay?
Yes.
All right, first of all, congratulations on your baby. He's so cute. Can you please verify your name and date of birth for me?
Jessica Hart, January 4th, 1988.
All right, and do you have any allergies?
Penicillin.
Okay, so as I was coming in, I was checking for the ABCs. Her airway is clear. She's responding to my questions clearly and talking fine. I can see her chest rising up and down, so the breathing is also good. As I was checking the name band, her skin is warm to touch, and I know the circulation is also good. So from this point, I'll check for the heart sounds and the lung sounds, as well as the bowel sounds too. So I'll just check it. So I'm listening to the heart, and I can hear the heart sounds. And I'll also listen to the lung sounds. Can you take a deep breath for me, please? Again. And I'll check in the back too. So since I'm doing the auscultation, I'll also check for the bowel sounds. So I'll check for each quadrant for the active sounds. And I know the bowel sounds are so hypoactive, and it's because she just delivered the baby yesterday. Did you have any bowel movements yet since the delivery?
No.
Okay, that's okay. That's normal. We'll still continue the stool softeners, okay? So for the assessment, the postpartum assessment, I would like you to lay flat on the bed in the supine position. So I'm going to lower your head, okay? And for my body mechanics, I will also raise the whole bed.
Make sure that it's shine side down. And I'll have the okay. And then I will grab her. Ready? Also shine side down.
So for the postpartum assessment, I'll follow the bubble assessment. For that, I know the bowels are hypoactive. I asked for her when she went to the bathroom for that. And for the bladder, when is the last time that you voided?
3 hours ago.
Okay, so it's almost time to void since it's about 3 hours. I would suggest you to go to the bathroom every 2 to 3 hours, and that's a good time that you can void and then do a breastfeeding for the baby. So you don't have to get up in between and all. Okay, so so that's the B and the B in the bubble, and I'll do the first B, which is going to be the breast. So so when is the last time that you breastfeed the baby? 3 hours ago. So it will be a good time for you to breastfeed too. So after the assessment, maybe I can help you with that. I would check for the breast for any redness or any discharges, okay? So for the privacy, I would take one breast at a time. I would palpate the breast for any if it's red or sore, if there's any lumps. I will check the nipple if it's everted or inverted. If it's inverted, then it will be appropriate to call the doctor. I would check for the colostrum. The colostrum is coming in, so it looks good. Do you have any pain when I palpate? No? Okay. All right, so I'll check for the other breast too, for any redness, sore, cracking of the nipples. The eversion or the inversion, it looks good. The colostrum is coming in. Do you have any pain in this one? No. Alright, so cover her up. Then the next one will be the uterus. So I'll just expose the parts that I only want to know. So for the uterus, I will check her fundus. And for the fundus, I would hold my one hand above the symphysis pubis and check for the top of the fundus and palpate it. And I see the fundus is firm and about 1 centimeter below the umbilicus, which is normal at this time. And it's midline, which is what we need. In case if the fundus is not midline, then I would ask the client to void, because the bladder distension causes the fundus to deviate. And if the fundus is boggy, then I would hold my hand above the symphysis pubis and massage the fundus to make it firm. And I hold it because to prevent the inversion of the uterus. So I'll close the uterus and then I'll go to the next part, which is the lobia. So she only delivered yesterday, so it will be lobia rubra, and she would have a moderate amount of blood. And the local good looks good, and I can also see the episiotomy there. So for the episiotomy assessment, I'll go with the readout, which is we'll look for the redness, any swelling, any ecchymosis. I'll look for any discharge, and I'll look for the approximation of the episiotomy. For the lochia, if there's any clots bigger than a walnut size, then I would definitely call the doctor. So small clots are normal. Hold close, and this bleeding is okay. I'll clean her up. I'll help her clean her up after the assessment. So at this point, I'll change the gloves and hygiene. Put on new gloves, okay? Then next one will be the home and sign, looking for any embolism or any pain in the leg top, or any red lines, any swelling. So in that case, I would ask her to call the nurse or the doctor right away. Next one will be, so for the hemorrhoids, I will ask her to turn to her side and I will look from the back to see any hemorrhoids or hematoma. And if there's anything present, then I would suggest her to put some ice packs, which would relieve her pain. And also, so Miss Jessica, I want you to go, when you go to the bathroom, I want you to wash your hands before and after, change the pads, and I want you to use the Perry bottle to squeeze warm water from front to back to prevent any infections, okay? So now will be the hemorrhoids, and the last one will be the emotions. And I know she is looking at the baby, taking care of the baby, happy with the baby, and talking to the husband, responding to my questions. Emotionally, she looks fine. So that will be the end of the golf assessment. Next, I would have to do the vaccinations. So I know she is immune to rubella, so she wouldn't need any vaccinations for the rubella. But she's A negative, and we're waiting for the results for the baby to see if the baby is positive, Rh positive, and in that case, we would give the Rogan injection within 72 hours of delivery. So, and also, I missed one point, which is the vitals. So we'll check the vitals, and I already checked the vitals like 10 minutes ago before the assessment, so they are all stable. And that concludes my postpartum assessment. Thank you.